Here in Australia, as well as in other countries like the UK and USA, not telling a patient of their terminal diagnosis would be considered unethical and disrespectful. It is seen as necessary for self-determination so they can make their own decisions about what they want going forward, which is a big part of Australian medical ethics. But this isn't the same everywhere around the world, for better or worse. Not informing a patient is often seen as a protective measure. But before we begin, we post death and dying related videos every Friday. So if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk not informing patients of their terminal diagnosis. In order to understand this question, we first need to understand the difference between individualistic and collective cultures. And I know any of you who have done a sociology course will be rolling your eyes at how simplistic this is, but stick with us. So, individualistic cultures are what we have in Australia, US, Canada, UK, Netherlands, Germany, etc. It puts a priority or emphasis on the individual over the entire group. In individualistic cultures, people are motivated by their own preference and viewpoints. This culture type focuses on abstract thinking, privacy, self-dependence, uniqueness, and personal goals. People in these cultures see each other as loosely connected and have a diverse population of different races, ethnicities, languages, and cultures. Individuals gain the most happiness from these three factors: personal satisfaction, internal happiness, and family satisfaction. People living in individualistic cultures use direct communication, low power distance communication, self-expression of emotion, and a variety of conflict resolution strategies. Now, people in individualistic cultures tend to think of their way as being the best and any other way will cause problems. But individualistic culture is what makes what's going on social media and the "I take offense to everything" culture possible. It also leads to elderly parents not being cared for, the terminally ill being abandoned, and the disabled being seen as a burden, and the whole "I don't like this one thing, so no one else can have it either" mentality. When it comes to medical care, the individualistic culture will prioritize personal autonomy and self-determination, i.e. the ability to make your own choices regarding what you do and do not want in your medical care. On the flip side of this, the opposite to individualistic cultures is collectivist cultures. This prioritizes needs and goals of the group as a whole over the needs and desires of an individual. In such societies, relationships with other members of the group and the interconnectedness amongst its people play a central role in each person's identity. Examples include countries like China, India, Japan, Ghana, Turkey, Greece, and Guatemala. In collectivist cultures, people are considered good if they are generous, helpful, dependable, and attentive to the needs of others. This contrasts with the individualistic cultures, which often place greater emphasis on assertiveness and independence. Collectivist cultures generally share these characteristics. Individuals define themselves in relation to others. For example, I'm a member of this tribe. Communication is often indirect to avoid potential conflict or embarrassment. Group loyalty is encouraged. Decisions are based on what is best for the group. Compromise is favoured when a decision must be made to achieve greater levels of peace. Working as part of a group and supporting others is essential. Common goals are more important than individual pursuits, and the rights of families and communities come before those of individuals. Now, this has many great benefits, as you can imagine. On the downside, collectivist cultures tend to have higher levels of social anxiety because of the need to fit in. People are also more cautious of sharing personal problems with others. Instead, people often seek out what is known as implicit social support. This involves spending time with supportive people without actually opening up about or addressing the source of stress. Addressing mental health in these cultures can be difficult, but on the flip side, they do tend to be much more resilient than many individualistic cultures. When it comes to medical care in collective cultures, there is often a deferment of the decision to the main family member in order to protect the patient. Now, most of you will be watching this from an individualistic culture and be horrified by this idea. You may think this main family member will automatically take advantage of the situation and use this situation to make their lives easier for themselves. This happens a lot in an individualistic culture. Now, this is a possibility in a collective culture as well. Humans are gonna human no matter what culture they're in. But the person making this decision is usually thinking of it through the lens of their collective culture. They are supposed to be generous and selfless. which in this case means taking on the burden of this bad news, the news of their loved one's terminal illness. It would be seen as selfish to burden someone with such news that would add to their stress in a time of sickness. Now, obviously, collective cultures are all different. Egypt is very different to China, for example, and therefore there are other cultural reasons beyond simply being a collective culture that would inform why they may choose not to tell a sick patient of their diagnosis. So let's give an example of this in practice. Example 1. In Chinese culture, family and doctors often withhold serious diagnosis from patients, instead sharing medical information with family members. Discussion of death and dying is also often perceived as bad luck. So when a patient of Chinese background is in a hospital in US or Australia, these cultural differences can pose a few challenges. This example comes from the US. Ms. Z, an 83-year-old Chinese woman with a history of blood cancer and post-COVID pulmonary fibrosis, presented to the hospital with a failure to thrive and low blood oxygen levels. No significant functional recovery was noted during her 3 weeks hospitalization. Palliative care was consulted for aid in advanced care planning. When the team came to speak to her, she gave short answers to their questions and would often end the conversation quickly due to feeling tired. Both she and her daughter at her bedside deferred their decision-making to her son, she was a widow, who told them that he did not want information shared with his mother because it would worry her. To balance the ethical principles of patient autonomy with the respect for the patient's culture, the palliative care team asked the patient what her preferences were for information sharing and medical decision making, and she expressed that she preferred her son to receive the information and make decisions for her. When the medical team's concerns were shared with her son that she may not recover, he continued to express hope for her recovery and expressed reluctance to discuss that she may not return to her prior baseline, but was willing to discuss contingency planning in case his hopes were not realized. This case highlights differences in the cultural norms both of information sharing and for the appropriateness of sharing concerns about poor prognosis. Recent studies. There have been many studies recently in the past 10 years in collectivist cultures as to whether this viewpoint of not telling patients their diagnosis as a protective measure is actually wanted by the patients, with most reports suggesting that patients tend to want to know more information than their families think. Most of this research has come from palliative care organizations based in Turkey, Iran, and Greece. And all these reports start by saying just how difficult it was to conduct this research, because in collectivist societies, people always want to say the right thing. Nevertheless, they persevered, and they came about some interesting conclusions. Firstly, younger people wish to be more involved in their healthcare decisions than the elderly, and even if they do not make the decisions, they wish to be informed of their diagnosis. Secondly, it was far more likely for females to have their health status hidden from them, often being outright lied to about it, and this was done by male and female relatives. The reports also noted an all-round frustration and not being able to prepare to see God, whichever God that was. Working in hospice, we see this a lot. People want to get right with God before they die, hoping for a smooth transition to the afterlife. And it's a bit hard to do that if you don't know you're dying, and that's what was reported in a lot of these studies. There was also a great sense of death avoidance in these cultures. Talking about it was just bad juju. Doctors said they didn't want to tell their patient their diagnosis out of protectiveness, but when pushed, they also said they just didn't want to give bad news, which is hard for anyone, but that's the job, and their training just hadn't prepared them for it. Not telling the patient was more of a self-serving measure than actually out of empathy for the patient. And there was a lot of that came up in these reports. The cultural line that is always said and is socially appropriate is "I am protecting them," when the reality is murkier than that. However, there was also a strong wish for cohesive support, that the entire burden shouldn't be put on the patient either. Many patients they interviewed said that perhaps it would be better if the family took on the burden of making the small decisions, but the patient made the big decisions, so the pressure of day-to-day decisions could be taken off them, which I think makes a lot of sense. So that's the cultural perspective on this topic. But there is another angle to this question. Children. Hi all, if you're finding this video interesting, please show us some love and click the like and subscribe buttons. And if you really like it, perhaps consider sharing it with others. And now, onwards. Children. A long time ago, we did a video about how to act around a terminally ill child as far as family and friends go. And in that, we mentioned how some parents wish to hide the diagnosis from their child. And while I wouldn't say this is common in Australia, it's not uncommon enough. Parents will tell us that we can't tell their child because the kid wouldn't understand, or it would be too much for them, or it will make things worse. And at that point, you may as well just say out loud, I think my kid's an idiot, and get it over with. Because do you really think a kid isn't going to pick up on what's going on around them? They are going to hospital all the time, or they are stuck in hospital. They have tubes coming out of them and they're being prodded constantly by doctors. Their parents are whispering to each other and to the doctors and yet being strangely upbeat in front of them. Random extended family members are dropping by. They feel sick, they're throwing up, they hurt, and yet their parents are telling them, "No, you're fine." How dense do you think your kid is that they wouldn't be able to put the dots together? A 4-year-old can put those dots together and at least come up with, I'm in trouble here. A 10-year-old can put those dots together to the point where they know they're screwed in this situation. Don't treat them like they're stupid. And also be honest with yourself. Losing a kid is hard. Watching your kid die is hard. No one is disputing that. So staying in denial of your kid's diagnosis is not helpful for anyone. Some parents say, I don't want to tell them because it will make all of this real. It is real whether you say it out loud or not. It just is. And this is part of the reason why many couples' relationships don't last long after the death of a child, because of this inability to deal with the loss head on and therefore be able to support each other. Now, does this mean you should tell your kid everything about their diagnosis? Not exactly. It depends on how old they are and what level of terminal illness they have. But at any level or age, they should be made aware that they are unwell. Now, this is much easier if they already feel that they are unwell or they're constantly going to the doctors a lot. A lot of kids and teenagers will ask direct questions, in which case answer directly. Some will skirt around the issue, unsure of how to ask but clearly wanting information, in which case you should answer broadly, letting them ingest the information a bit at a time. Generally speaking, the younger the child, the less they need to know immediately, but you will eventually need to tell them. Of course, this is different if they only have a month to live. Now, in this case, doctors and support staff like myself will often sit down with you and explain how to go about telling them in an age-appropriate way. Typically, we advise if a child has many years still left to live, then parents should sit down with their child by themselves and explain. But in this more immediate scenario, while we would suggest parents do it by themselves, support staff can absolutely be in the room as well. In this case, the diagnosis and its outcome should be explained by the parents with help from support staff. And when we feel the shift in the room and you could feel the child doesn't want a random stranger around anymore, we quietly exit the room. Telling a patient of their terminal illness diagnosis sucks. But if you choose to go into that field, you suck it up and do it. There are pros and cons to the patient making all the decisions. There are pros and cons to the family making all the decisions. But even in a collective culture, there seems to be a want to at least be informed of your diagnosis. Because no culture lives up to its ideal form. And to reiterate, as we said earlier, humans are going to human regardless of external factors. And with that, go talk death.